Atlas.
Welcome back on the Health Watch this afternoon. Hartford Healthcare held its annual Stop the Bleed event yesterday in honor of National Trauma Awareness Day.
And what they taught could save a life someday. So if you missed it, here's Tim Lammers with a couple of bullet points.
Here's hoping you never have to deal with a traumatic injury, be it to yourself or to somebody nearby. But if it does happen, you might be the only person around who can stop the bleeding.
Intervene as quickly as possible, because just that couple of minutes buys me a lot of time in the hospital, and we can revive people.
Dr. Alfred Croto is a trauma surgeon at Hartford Hospital. Now, he can save a life, but the trick is to keep a trauma victim alive long enough to get to him. That was the idea behind Hartford Healthcare's Stop the Bleed event Wednesday. And Dr. Croto said to control that bleeding, the first key is to control yourself.
One of the things, and it's easy for us to say, but is not panic. We really want to enable people and empower people to move towards the blood and help stop the bleeding.
The next key to handling the pressure is to get to work applying pressure.
And then for most, the vast majority of wounds, you can hold some kind of clean dressing over it or clean cloth over it with direct pressure, and bleeding will stop.
If the bleeding is in a wide area, you should apply pressure in a wide area too. However, an especially deep wound like this could prove much more tricky.
So the wound itself can be a lot deeper than you think, and so as you're holding pressure, you want to try to pack the wound, try to put gauze in the wound and put pressure on top of it.
And if that doesn't work,
you can tell if a wound is deeper if you're holding pressure and it's not stopping. Then you're likely injured deeper vessels, larger, deeper vessels, and are going to need packing and probably a tourniquet.
Demonstrators showed how to apply one of those as well. Although Dr. Croto said these techniques are primarily for injuries to the extremities, like the arms and legs, where it's easier to apply pressure down to the bone. For deeper cuts to the midsection, it's even more imperative to get to a hospital as soon as possible. I'm Tim Lammers. We'll see you tomorrow when we're all local, all morning for the Fox 61 Morning News.
Critical information right there. Also on the Health Watch.